Okay, welcome to the Aesthetics of Marketing Success, the podcast where we explore what it really takes to grow a standout aesthetics or wellness practice in today's evolving market. I'm your host, Ryan Plano, and today we're going to go beyond marketing trends. We're talking about what it means to lead a practice with purpose, precision, and future-forward mindset. Our theme today is building a practice around innovation, autonomy, and transformational care. This episode is all going to be about how to design a practice that doesn't just follow the industry trends, but sets them. Whether you're established med spa or a wellness provider exploring functional medicine, today's conversation is going to be packed with insights on how to implement cutting-edge therapies, communicate deeper value to clients, and build systems rooted in long-term results, not just one-off services. Joining us today is someone who embodies this exact approach. Chris Claronimus, also known as Doc K, the medical director of UpgradePDX. He's a decorated clinician and a veteran with over 15 years of experience in functional and integrated medicine and a background that literally spans everything from acupuncture and herbalism to pain management and human nutrition. Doc K's protocols blend science and tradition, innovation and intuition, and his mission is clear: empower clients with the tools and education to achieve true health autonomy. Today, we're going to unpack how he evaluates new therapies, educates clients without overwhelming them, and what he'd do differently if he was building a new practice from scratch. So Doc K, welcome to the show. How you doing today?
Hi, thanks for having me, Ryan. Appreciate it. Flattering introduction.
You're welcome. Yeah, we like to make sure it's worth your time. So,
yeah, hopefully I can live up to it. All right.
No problem. We'll just kind of dive in. And one thing I noticed is that your fresh medicine protocol is incredibly comprehensive. For other aesthetics and wellness business owners that are listening, can you share how that framework kind of shapes your treatment plans?
Sure. So, really my joke is I actually wrote that out so I would remember to do everything. But I historically saw very complex patients, right? Central pain syndromes is what I was most known for. And that's associated with like chronic fatigue syndromes and chronic infections and things like that. And so the protocol, which is an acronym for food, rehab, endocrine, sleep, hormones, medications, musculoskeletal, mitochondria, exercise, detox, inflammation, immune, nutrients, and environmental stressors.
Amazing.
Super long mouthful. But basically, you don't have to really worry about that. What you want to conceptualize is that you need to address multiple systems and ideally have them be mutually supportive across multiple systems, right? So you can't just target inflammation without maybe addressing immune. You can't target oxidative stress and poor nutrition without touching on the mitochondria or vice versa, right? So that's kind of the concept. And some of the things are very simple. Environmental medicine or environmental management versus detoxification, is really just about, hey, are you eating clean? You're not getting processed foods. Are you really buying organic or at least scrubbing and peeling the things? Not using Teflon, not microwaving in plastics. Are you, those kind of things? Do you have air filters in your house and spider plants to absorb stuff? That's just environmental management. That's fairly simple. More complex would be something like chronic infections, where you're having to deep dive and address in a multi-pronged, very comprehensive approach. So that's kind of the strategy. So whatever level a provider is, depending on their one interest and two, licensing or just their clinic setting, you can frame something of your own or use that to sort of recognize all the things you have to address, whether you're addressing it or you're referring it or at least giving them education around it.
Okay. Yeah, that makes a lot of sense. And it kind of seems like you've leaned into this root cause, whole body optimization, right? Which is a little different than like a med spa industry, which kind of quick fixes dominates the conversation.
Yeah.
So how do you communicate that deeper value, what you are offering to the clients in an empowering way that doesn't overwhelm them?
So, well, I haven't figured out how to not overwhelm them yet. It tends to be a fire hose of information, right? My initial consults are 90 minutes long.
Okay.
They're very long. I mean, not necessarily for somebody who's just coming in for something very simple, but for somebody that has maybe some amorphous or kind of multi-system things like, I just have fatigue and I have this and I have that and I've never felt right since whatever. That's a deeper dive. The, the really, root cause things are sort of the basis of both naturopathy and functional medicine, right? Those are concepts that are ingrained in that. And that basically is just a different approach than biomedical medicine. It's not better, it's not worse, it's just different. The idea is that it's nonlinear, right? And that kind of goes back to that protocol, is that you can't address a single thing at a time. So I usually, for something like a med spa, I would really probably focus on sort of what we call the pillars of health, right? So no matter what you do, if you're not eating well, you're not sleeping well, you haven't addressed your, however you want to call it, either your mental health or your spirituality, and are not moving,
Right.
doesn't really matter what else I do.
Yeah.
Like
It's a big
that amount, I'm sure everybody's happy to take somebody's money, but results are not going to be there for that. Even with amazing things like GLPs and things like that,
right.
you're going to probably see less benefit or more of the things we don't want to see, like loss of muscle mass. Right. Without addressing those things. Right. So I convey that as a core principle. And I usually use the analogy of, if everybody's a cup of water, we all have water in the cup. None of us are probably 100% perfect health with nothing wrong. I wish that was the case, but it's not. And when water starts pouring out of the cup, that's when we start to have symptoms. And when it pours out a lot, people tend to go to the doctor, seek out help. And then our job is to come along, poke holes in that cup and kind of try and drain it and rein it under control.
Okay.
So the analogy is, if your cup's under the faucet and the faucet's on, I can't put enough holes in that.
Right.
Right. And so that's where those pillars have to come in, right? They still have to, no matter what, they have to do things outside of your office.
Right. Yeah. That makes sense.
Right.
Yeah. So there's a side of what you can do, but then obviously you have to have the baseline. You got to get the basics right. And then beyond that is where you can kind of step in.
Exactly.
Makes sense. Okay.
Or help facilitate it. Right.
Help facilitate. Okay. And as far as stepping in and things you can do, one of the first things I noticed about your practice and your website in general is you offer a lot of services, and a lot of them are even cutting edge. I usually try to pride myself on knowing most things. There are some things on your site I've never even heard of before, which is intriguing to me, and I'm sure other people as well. So even things that that might not even be super cutting edge to you, peptides, PRP, still kind of new in the aesthetics and wellness space, but there's more treatments hitting the market. How do you personally vet like what's worth bringing in? And what advice would you give to owners who are trying to innovate? Because the aesthetic side has been big, but a lot are trying to move to wellness now.
Mm-hmm.
How do you understand, like, if they're trying to innovate without getting too sidetracked, like, how do you personally these new processes or procedures or even just medicine?
So that sort of ties into something you mentioned in the introduction of like what I would do different. I would say siloing is much more strategic, siloing specific services that are your strengths that you can manage in either packages or bundles or with little deviation. Yes, it is less personalized in that sense. Right. And so hopefully you can, depending on what you do, you can still personalize some aspect of it.
Right.
But I have all these services and things because they've been added over the course of 15, 16, 17 years in a patient population that was very sick. And so essentially that was a different drive. That drive was, Chris needs to figure out something that works for these people, because not everything works for everybody. And when they're very sick, like I said, when you're intervening on multiple systems, you need different tools. So I sort of ended up with just a lot of tools, right? Now I would say it has, even though I offer them all, it has scaled down and I have a lot more core therapies that I rely on. Peptides probably being the largest for me in my patient population. But I would say siloing is a thing. I would say everybody can't be an expert on everything.
Right.
So I've always said, hey, I'm a specialized generalist because I do so much and I'm pretty good at a lot of it. But if there is a patient that I feel has either exceeded my pay grade, so to speak, or I have not gotten where I want them to go in terms of moving the needle, I have no issue sending them to the targeted specialist that does just that for at least an opinion,
Yeah,
right?
that makes sense.
So narrowing would be a thing. Pick something in wellness that you could, I mean, from a business side, of course, you want to have some way to monetize it, right?
Right.
Some way to potentially scale it, of course, right? So most people are saying like, oh, we have supplements, and that's fine. I personally don't stock them. Over the years, what I found was, I mean, that's a bigger profit, and people do tend to buy them more frequently when they're sitting right in front of them. You hand them to them across the counter.
Right.
But I did find, depending on your volume, and again, this goes back to what you're treating or what your focus is. If you have to outlay $5,000 in supplements to address all these things, sure, you might make 10, but you're still holding on to 5 in product and so it's never really a profit. You're just kind of swapping one for the other
Right.
in terms of a money juggle. What I have seen from colleagues who have sort of maybe more tailored or targeted practices, if you can get down to a few things, you're not holding 47 products of inventory. That's a better strategy, right? Because you can turn those over. And those are easier to swap out if you do say, oh, you know what, I found one better. Or people aren't liking this one or whatever. That's an easier switch. So that's always an easy angle. Diet and nutrition's tougher because it's time consuming and it takes compliance. The last probably year and a half, I've been implementing some more tech heavy methods to sort of help people do that. So am I allowed to mention a product name?
Yeah, I was going to say,
I'm
yeah.
not affiliate. I don't.
Either are we. No, I'm curious to hear
Yeah.
specifics. I think other people are too.
Yeah, I have no financial interest in these, but so there's like things you can leverage, right? CGMs are a big one. They're readily available now. There's versions that you don't need a prescription for, right? Like the Stilo. I have one on myself right now.
Got it.
I just track on my phone, and you can explain to people that they can visually utilize that to see like, hey, when you eat certain things, right? It's very much affecting your glucose.
Right.
We had some sushi the other night. Rice didn't increase my glucose at all, amazingly. But I had some Mediterranean food and I had some pita with it, and my glucose shot way up,
Right.
which is very disappointing for being Greek and Italian.
Being Greek.
Right. Like that is very problematic for me. But so you can identify these trends. And then most of them link into Apple Health, Garmin Health, or all of those kind of things. And they're even starting to get integrated into more wearables. And so for those core pillars, Oura Rings, Apple Watches, things like that, where you're tracking your sleep, particularly deep sleep and sleep trends and heart rate variability, are helpful.
Right.
For the diet and nutrition part, continuous glucose monitoring, and then the Lumen devices, which are, have you seen those? They're oral breath testers. It's called the Lumen.
Okay.
So you breathe into this, and it's tied to your app. It's tied to an app, and it basically measures CO2, and then can based on that tell us the level of fat or carb burning in your system.
I've seen that.
And so, very generically, perfect world, you want to wake up in fat burning, you stay in fat burning for a period of fasting. When you start seeing, let's say you fast for 4 hours in the morning, and you're seeing those readings in fat burning, but all of a sudden it bumps up a level or two. That means your liver is starting to dump glucose because you have too low of sugar, and then you can dial in your fasting window. So you get this visual aid, and it does provide macros for you, and you can say I'm on a GLP or I'm a diabetic or whatever. You can set goals, and you can take pictures of your food and it'll track the macros for you. And the idea is that visually you're trying to train your body to become metabolically flexible, meaning that it can handle fat burning and carb burning. The sort of science now is moving away from straight keto, straight vegan, straight, right? And probably what our grandmothers and the old school coaches used to tell us, like, do your carbs by your activity level, right? And then have healthy carbs and healthy fats. And I mean, there's nothing wrong with some of the more rigid diets if they are done properly. I think very few people can do them properly because it becomes a little bit of a religion. So I'm not generally a fan of that. I mean, I think people should just be able to live within reason, right?
Part of that, yeah.
So metabolic flexibility is one way to do that. And monitoring that visually literally gives you feedback, and then tied to a glucose monitor, you're getting a lot of information.
Oh, yeah.
A level up from that, no pun intended for my tagline for my clinic, is there are companies like Thea and Prolon, which is L-Nutra, where you can actually enroll people in programs via your clinic. And so like the L-Nutra program, they have dietitians. They'll send you, depending on which program you enroll in, send you fasting mimicking diets so that people can do intermittent fasting. And those have evidence, and then you're coached. Thea has a similar thing, but it's based more on the glucose monitoring side of things. And you can even combine those, right? Buy a couple of Prolon kits. So you can start pretty simple with purchasing devices and reselling them. And I think that is a learning tool that, one, empowers patients, two, gives you that reach outside of your clinic.
Yeah.
Right. And helps train people to do it right themselves without relying on you.
Yeah, that's great. So I do like this from someone who's trying to get into wellness. So are you integrating these, like, for instance, Lumen, things like that? Like, are you integrating them as part of your practice? You're going and saying, hey, listen, we're going to check your CO2. We're going to check some readings. And then from there, I'm going to help guide you and put you on one of the fasting mimicking diets. I think Prolon is that Walter Valongo. I think he's the one that I've looked at that before. I've never actually done it. It's like, it is very interesting. So you're using these tools and then integrating them as part of your care for the patient. So then the patient has access to this tool. They're, buying it, you're buying it for them.
Correct.
Okay.
Correct. So I did it. I purchased Lumens and you can buy them to have a set membership attached to it. So I've paid for them. Somebody purchase it, and they get, in my clinic, I did it as a 3-month. Of course, they want you to do it forever ongoing. Right. But for what I'm trying to accomplish, if you've done a few months, I mean, unless you're really obese and you need a longer program, or you're diabetic or something like that, where you're really struggling, most people, if you do it consistently, monitoring your glucose and doing your breath testing in 3 months, you're going to get that concept and probably have dialed in your stuff within reason.
For sure.
Right. And then even without the membership, you can still spot check yourself. It just doesn't track the data.
Okay. I see what you're saying. So you can check it out. Yeah, we have a line in the marketing world that says what gets monitored gets managed. And I feel like, because we're looking at KPIs, it's the same thing with food. I've even just noticed personally, when you just start tracking even just macros, just that, am I getting enough protein, right? All of a sudden, you're motivated to kind of eat a little cleaner. You might need to get a couple extra steps in. So I like the idea of how you're integrating the technology, though, because you're making it easier for someone that probably would not be able to do this without the technology. And it's kind of novel and fun too. So maybe that kind of gets them kickstart a little bit.
For sure. And sometimes, like, I build those items into I call it a metabolic program, not a weight loss program, but it is that. So I build those in. They're included with things like GLPs and specific nutrients and and peptides and things like that. It's a pretty comprehensive program. It includes labs and things like that. But on a much simpler basis, and honestly, probably more financially of benefit, is there's a reason these corporations are doing, like, call in and we'll give you your script for this and the thing. I mean, that's more financially, lucrative, let's say. You can scale these. You can still use them pretty simply. Like, hey, I want you to do a start tracking,
Mhm.
see if you can identify patterns. If you can't, come in, we'll talk about it. And then dial in that fasting window. And then maybe next layer or vice versa. Uh, let's do a fasting mimicking diet once a month. And then that's pretty basic, right? And you get a lot of health benefit out of that, right? You're
Absolutely.
improving metabolic flexibility, you're improving mitochondrial autophagy and mitogenesis. So you get some good things out of just really basic things. And then you can kind of layer on top of that however advanced you want to be.
That's great. Yeah. I love the idea of how you're just integrating directly what you're doing, but you're also empowering the patient or the other client to kind of take ownership of some of their own numbers and stuff too. That's a practice that they can take. They don't have to come in every single day or every single month or whatnot once they kind of get it
Right.
down. And that's nice. That's awesome.
Right.
Because we were kind of talking about technology. Are there any tools
Mhm.
that like are on the forefront or something you're seeing or something like you're interested in that's coming or that you heard? Even the Lumen's pretty cutting edge in general. I think there used to be one called the PNOE back in the day, but it was a full
Well,
mask.
that's what I was going to tell you.
Yeah.
So, yeah, so VO2 metabolic testing is certainly very useful because it gives you your rest, and body composition, right? So I have a full in-body system
Okay.
that
Scanning.
integrates blood pressure, body composition, height, weight, and even dynamic hand grip strength, because that is one of our key indices for longevity and sarcopenia. So for a wellness perspective, right? And that kind of helps people like, hey, look, if you forget your body fat, you have a terrible grip strength, you're statistically at risk for all
Yeah.
sorts of morbidities, right? Maybe not mortality, but morbidities.
Yeah.
So, hey, let's get on the gym. Look at your visceral adipose tissue. I don't care that you look great and skinny. You have tons of fat around your organs,
Right.
right? So, I mean, with really simple things, you can make profound recommendations. So, like let's take a med spa, for example, that is, people aesthetics and those kind of quick fixes, right? A body composition would be huge because you can say, hey, look, you have far too much visceral fat. You have, or whatever, your proportions, however you want to do it. You don't have enough muscle mass. You could start with two peptides. Let's start with a GLP and get that visceral fat down. And then maybe we could use a GHRP or GHRH growth hormone one
Yes.
to offset the muscle loss and get some increased muscle. And you'll get the spillover benefits from that anti-inflammation, right? Immune system function, all sorts of things. So, really simple. That would be a huge bonus. And the benefit of something like InBody, at least, I mean, there's lots of systems,
Right.
but the nice thing about InBody that I like is it ties to an app so they can see all their data. And any InBody they use anywhere in the world will port that result into it. So it's very easy to track. So technology like that, VO2 testing and metabolic testing, there's probably four major companies. Pinot is the one that has the kind of marketing share. They sort of reside on the non-active testing, even though you can do the active testing. So you get resting metabolic rate and lung capacity and some analysis of that. And then it can tie in. The nice thing about Pinot is that the reports tie into things you may have in your practice if you white label it. So it would say like, hey, you have red light. This value has been shown to be increased by red light, consider that, or an IV or something like that. For athletics, if you were at a higher end sort of athletic optimization, I think that there's more accurate technical systems, though that would also work if you didn't want to buy two, right? And that's like the Splendo health system that incorporates different tech into a software that crunches all that data.
Wow.
And that's run out of the head medical physiologist at Duke University put that together.
Right.
And it's the system that the U.S. Special Operations Command utilizes to evaluate operators. So technically very profound, and you can do a lot of cool things with that. It's an active test. So you can actually see like, hey, when you're at this exertion level, your brain is not reoxygenating at the highest capacity it can, or you're getting tired because your demand of, let's say, thigh muscles is exceeding what your respiratory capacity can keep up with. And then you can make sort of specific recommendations. Okay, let's do some respiratory fitness. Let's adjust how you breathe, right? When, simple things, right? Here, let's stay in these heart rate zones. So there is, without being, crazy down the rabbit hole.
Yes.
Because the complexity is more certainly in things like the peptides and the supplements and the herbs and the, doing all that. You have to order them. You have to know the doses. You have to be able to manage them. You have to, how do you layer them and stack them? The tech is a lot easier. The downside, of course, being the cost.
Of course. Yeah.
Tech is spendy, right? So that's really the downside. But for a spa, something like, body comp and glucose monitors, and it's so easy, no brainers. Like they literally just walk out with it.
Yeah.
Right. And then it maybe lets you monetize it in terms of like a GLP or something simple.
Right.
Right. Or even like targeted adipose loss with MSculpt or one of those type of targeted cryo, lipo, whatever the case may be. Right. Because you can say like, hey, your underarm percent of fat is very poor as compared to the rest of you. That's obviously a very localized fat deposit. Let's get that out with cryo or MSculpt or lipo or whatever the case may be.
Yeah, that's great. I love the mindset there, because a lot of times when you're talking about body contouring, people come in because they just have a feeling or they see something that they don't like or are confident in. But if you had some numbers behind it, and then you can say this area, like you just mentioned, that's great, because then there's some metrics behind it. There's some science. It's not just all vanity, right? It's not just what it looks like.
Yeah.
There could be some.
Yeah, and most of them, for sure. And most of the reports compared to the average, and it is an average, right? Not the athletes and whatnot, but at least it gives you a comparison. And there's some other systems like the 3D scanners.
Yeah, Staikus and
the Staikus. I mean, maybe for a true clinic that's doing things like the lipo and that kind of thing, that might be better because it's purely visual. Right. Yeah, versus sort of that crossover spa wellness, which data might be better. Right.
Yeah. No, that makes a lot of sense. No, some great stuff. And I love kind of hearing the new technology, but also hearing how the technology is being incorporated. Because other people have that, or they've seen stuff, they don't know how to possibly incorporate it. But I love the idea of what you kind of came up with, is using it as a bit of a diagnostic tool, but also like a way just to see progress as well, too. So that's awesome. Great. So I know we kind of mentioned this a little bit earlier, and you've obviously had a practice for a good amount of time. We like to ask, if you were going to build a brand new practice, wellness, aesthetic, really matter, from scratch today, is there anything you'd absolutely do differently based on what you know so far from running a high performance practice at this point?
Oh my God, so many things. Everything different. Do we have another hour?
Yeah. What are your top one or two that are just like on your mind?
Siloing, like we were talking about, for sure.
Focusing this.
I would pick, if I was to do this again, and I'm actually exploring this, I would pick a specific thing, a protocol or some approach, whether it was, okay, I'm going to target athletes and go for optimization, or I'm going to target middle to older age people and target longevity, or I'm going to, right. And there's some crossover in there. You could do maybe 2 things or 3 things, but I would very much target it. I would have it defined protocols. I mean, and now in my head, I've been doing this long enough. They kind of are defined protocols
in your mind.
They're not, it's not the same as like, hey, this is our focus. These are what we're using, whether you change one out in 6 months or not, because nobody liked that or whatever, it doesn't matter.
Right.
To be able to plug and play it versus, this thing, I have 47 choices. Like, pick the things, right? Do it, even if you have to change them later. I would keep it siloed. I would say tech and memberships. I've been trying to add memberships because I'm in a gym.
Okay.
Believe it or not, has not been as successful as I had hoped being in a gym. interestingly.
As far as bringing client acquisition, right? Like there's
It
people
brings
seeing
client
you.
acquisition. Yes. Yeah, it brings in people, but there's something about the, like, well, I already have a gym membership. Why do I need to do another membership? Like
Right.
something about it being in the same location. Now, it could be my location, it could be the state, it could be, who knows, a variety of things. But something that I would say the biggest mistake I've made over all the years is that I tied all the medicine, I tied the clinic and its value to myself versus having it be sellable without me, generate income without me,
Got it.
right?
Okay.
In a passive manner, right? Through memberships and things of that nature,
Got it.
right?
No, that makes sense.
So,
That's very common in many different industries.
yeah, I mean, if I got hit by a car, the place is probably not worth much other than the equipment and kind of the ease of setup,
Right.
right?
Yeah.
But technically, I would design it, and that's kind of tied to the siloing. You could train somebody to, this is what we do,
Right. Yes.
right? And that makes it a lot easier. Plug and play, I guess, is my bottom line
Okay. Yeah.
point.
That's just great business advice, I would say, in general, for any business, that if you are the linchpin to everything, when you remove that, what else is there, right? And especially when you're going to sell or scale or something, like if the owner is everything, yeah, that's up. It's funny because a lot of times we try to teach the owners, the operators, like the opposite, that they kind of have the business, but they don't have a personal brand. Where sometimes when you have that personal brand, if you are famous in your industry, that can help bring in more clients because you're omnipresent. You're kind of saying the opposite with like, hey, that's great, but also make sure the business there's SOPs and there's processes and there's, maybe some layers in place so that you could step out and you're not just substituting time for money with everything you're doing.
Right, because I'm 55. So at 35, it wasn't a huge deal.
Right. Yeah.
At 55, and I did do a lot. I've been on documentaries and TVs and I still lecture pretty frequently. And so that did, of course, bring in people, but it just tied them to me. Right.
Yeah.
Not
no
the
handoff.
which is fine. But then at 55, when I'm hoping to have an exit strategy at some point, not work till I'm 75, 70 hours a week,
Of course.
like I don't really have it in the same way. So that's what I'm trying to do currently, is restructure and sort of revisit that concept and make that a larger piece.
That's great advice, especially for people that are either just starting off or, are going down that road right now where they're a solo injector or, a PA that's just kind of that rented a room. So that's really good advice for a lot of different people.
Yeah. And frankly, the landscape of medicine is extremely different now.
Okay.
Right. I mean, it's very corporate, right? It's very hard to compete against that. There's a lot of direct to consumer stuff coming out, labs, right? A lot of it.
Very affordable.
Imaging, it's very affordable, and that's great for patient access, harder for people who are in medicine, right? Because you either get unable to monetize that portion of your practice, or you kind of get stuck scrambling because they bring in, here's my 42 reports that I paid for. I said, right, what do I do? So, and then the other thing that I think is significantly changing, is that insurance base is almost impossible if you're small now. Yeah. I mean, corporations are taking over direct to consumer, but I would say AI is going to start dominating the field.
I can see that.
And frankly, it's probably going to do better. I mean, there was just a study done where they took, there's some standardized like case studies that they use to train residents.
Okay.
And so they, and they're kind of average. That's what all residents use. And they're not necessarily overly complex, but they're designed to get new doctors to ask the right question and lead them to the place they're supposed to be, right? And so they pitted a doctor by himself, an experienced doctor utilizing AI for the backdrop, and then AI by itself. And the AI by itself won. Because the doctor by itself would periodically go, not do the right question and go down a wrong path. With the AI, an experienced doctor wouldn't trust it. And so would override it. So, I mean, it could partially be about training too and familiarity, right? And just getting that's a new thing. But I mean, I don't care what anybody says. Our brains do not have access to 700 databases instantly.
No.
Right. And they are coming with some more medically specific ones. I think currently, last time I checked, and don't hold me to this because I don't know, I'm not tied to them, but I think Azure, which was one of the ones that is like large language for medical and was showing to be pretty good. So there's some stuff coming.
Yeah, it's amazing. I mean, I've used it personally, like for physical therapy or stuff, or even reading some reports or basic metabolic, panels. What is this? What's low? How do I fix it? And it's boom, it's there. Now,
Exactly.
if they told me something wrong, I wouldn't know, but it's definitely helped me. So I think there's always going to be a place for expertise, right? Like yourself and stuff and to guide and to make sure, but the quick access to the information for sure. Well, that's awesome. I mean, I was going to kind of talk about the future, your vision for Upgrade PDX, but I feel like we've kind of gone into it and you've talked about AI and things like that. Is there anything in the near future or even the long-term vision for PDX? Obviously, you've talked about siloing and kind of like focusing a little bit.
Yeah, I'd say my next immediate focus is one, partially on the business to kind of get that passive piece going. I'd like to add some tech that's more cohesive. So a lot of my tech I've had for years, and let's face it, tech is exponentially better every second of every day, right?
Yeah, almost.
Of course, with coinciding costs, but now we're actually starting to see multi-purpose tech together. So, my clinic, because I've had all this and with piecemealing it over time, somebody might come in 20 minutes in the red light and then jump on a pulsed electromagnetic bed for 20 and then do this. Well, now we're starting to see there are a lot of companies where you can get in a red light bed that's also doing your PEMF nap and while you're breathing hydrogen inhalation, right? So you're getting 3, right? And that's one efficient. So one, you have to buy one piece of tech. Yes, it's probably as expensive as buying 3 individual pieces. But in terms of square footage, right? Footprint, efficiency, and logistics of scheduling,
right?
Those things are huge, right? Because it's easy to schedule, here's one machine every 20 minutes versus here's 15 machines with a variety of combinations that you can do.
Yeah, that makes sense.
Right?
You only have so much room, so much time.
Exactly.
The big PEMF beds I used to lay on, the huge beds, and now you can combine it. That's great to hear. And just sitting in red light was always kind of boring. So if you can get a couple different things, I think people would eat that up. That's great.
There's a few coming out.
That's awesome. Well, this is great, Dr. K. I appreciate everything. If someone wanted to get a hold of you, number one, maybe just to throw some questions your way, if they're trying to go down this wellness, or you struck a chord with someone about something they have a problem with, or maybe someone's just even local in the area, right? That might want to just talk to you from like a client side or a patient side. How would they find more information about you?
Sure. So you would go to UpgradePDX.com. The official practice name is Upgrade Medical. You can do a 15-minute free discovery call. You can book that from the website if you really had a lot of questions. In terms of establishing as a patient, I'm licensed in Oregon. I have to see people in Oregon. Or you can reach out on the email, but it is just me. So if it takes me a beat to get back to you, just let me know. But yeah, and there you go. And that's just upgradepdx.com.
Perfect. Well, thank you very much. We'll put that information in the comments for the show notes so people can kind of click on that and see that. And I appreciate your time and hope you have a great rest of your week.
Thanks, you too, Ryan, and happy Father's Day to everybody who's
thank you. We're coming right up on
needs that. Exactly. All right. Have a wonderful weekend. Thanks for having me on.
You're welcome, Dr. Good talking to you.
All right. You too. Cheers.